Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and this is Juju, my 18-month-old French Bulldog who's in training to be an office dog, and she's doing a wonderful job. We're so proud of her. She greets everyone nicely. She makes you feel at home, so she's doing a wonderful job. So today I thought I'd just talk about my general philosophy on treatment because it can be a little bit confusing, and I understand that. So I wanted to let people know how I view this situation. So almost all the people that come to me have multiple infections. I mean, 3, 4, 5, 6, 7. I've even had somebody have 12 infections. And in addition to which, most of them, 90% of them, also have mycotoxin illness. And most of them have had COVID at least once, and they've had COVID vaccines. And so their immune system is completely derailed, just completely derailed. And, and so as a result of that, their bodies become petri dishes to all of the organisms in the universe that you would normally be able to fight off. Things like human herpes virus 6, cytomegalovirus, parvovirus B19, Epstein-Barr to a certain extent, HSV 1 and 2. When you have an intact immune system, you're less likely to contract those infections. So the way that I approach all the treatment is you want to lower the pathogen load, you want to lower the inflammation, you want to increase immune function, and increase detoxification. Because when patients come to me, they have a high pathogen load, they have high inflammation, they have low immune function, and low detox capabilities. And so you really want to tip the scales in the other direction. And in that way, what happens is, as you begin to tip those scales in the other direction, you'll start to see symptoms get better, and the inflammation will become less. Juji, honey, sit still. And then, by definition, we get you well. Now, I never use the word cure because I think it's inappropriate. And I'm not sure that you can actually be cured of tick-borne illness. I think some children can be cured, but I think it's more appropriate to say that you get people into remission and that they achieve wellness. And wellness meaning they don't have symptoms. They can live a normal life. They can exercise. They can go places. They can eat out. They don't have to live on restricted diets. They don't have to take antibiotics. They usually do have to take a few herbs, but that's just maintenance. That's just to make sure that whatever organisms are left, that they don't take over. So I wanted to review the way that now it's obviously way more complicated than that, because, if you have thyroid issues, you have to address them. If you have hormone issues, you have to address them. If you have exposure to EMF, you have to address it. If you have glyphosate or chemical exposure, you have to address it. If you have SIBO, it's way more complicated than that. But I wanted to boil it down to just the very basics so that you understand what I'm trying to do. I'm tipping the scales in the exact opposite direction for which you've come in for, okay? And we hope that by the time that you leave here, that you have an intact immune system and that your pathogen load is close to zero, and that your inflammation is well under control. And then you do have to control your inflammation with diet, no question. Does it have to be really, really strict? No, but you cannot sit and have cookies every day. That is not going to work. Or potato chips, or Fritos, or anything like that. You have to eat whole foods. And that doesn't mean you can't have a treat, but you have to be pretty rigorous about your diet. It has to be clean, preferably organic, although it's so expensive to eat organic that, some people can't afford to do that. So I hope you found this information helpful, and I hope you have a wonderful day. And so does Juju. Bye-bye.